Okay.
Okay, I just have a couple updates I wanted to provide, and then I'll let Lisa kind of address anything she may have. I know there were a few items on the agenda, and really this is just a resource for us to be able to kind of help support you guys and answer questions and address issues you guys are running into. But since there's so many new people joining today, just to let you guys know, we started our transition to the Ohio ISP in July of 2022. We are well into our transition. As of last week, we officially have 50% of our service plans in the new Ohio ISP format. So we're very excited about that and all the hard work our SSAs have been doing to get that done. Just to let you know, and we've updated before, we are not yet fully integrated into the DODD Salesforce system. So if you're working with other counties or have seen other things through the state training, we are not fully integrated into that system yet. We just started our pilot for that in January, and we're hoping to attempt to upload our first Ohio ISP into Salesforce this month. But we're just piloting that right now with Britco. It's been a really slow rollout, but getting the plans into the new format, using the new assessment and service planning documents has kind of been our big focus. And then I know many of us met back in September to kind of go over where we were at in Lucas County and provide some training and feedback. And so again, just want to check in, see where you guys are at, what issues you're running into and how we can help.
Thanks, Erin. Hi, everybody. My name is Lisa Ahlersmeyer, and I'm with DODD. Thanks for attending the meeting, and also thanks for inviting me to the meeting. Erin and I talked a little bit before the meeting today, but my takeaway was that people might have questions about the Ohio ISP, and so I'm here to help answer some of those questions. And if I don't know the answer, I'll certainly get it for you and bring it back to the team. So I do want to open it up to the floor for questions related to the Ohio ISP.
I have questions about documentation. I've done like the DODD training, and it's pretty easy and simple, I feel, on how they train to documents, but I feel like the ISPs that we're seeing aren't coming quite as like simple in that summary box or the service box. So I don't feel like the training and what we should actually be doing is always lining up. So just for how we set up like doc sheets, I know the training, I guess I'm not exactly sure. So anyone just chime in of like any questions off of this, but like for the training and everything, it was like each box is pretty much a support, but we're getting a lot of different supports in one box, which if they have the same frequency, that's fine. Like we can still, like the expectation in my head would be to still split those into separate services to document on. So correct me if I'm wrong on that, but even if they're in the same box on the ISP, it doesn't matter. We should be separating them out because they are actually different supports.
Well, I mean, I would say this, if they're in the same box, you could potentially put them all together, but Erin and I talked a little bit about this, and I think some guidance from Rachel is that Rachel Roseman, some of you may know, she's the regional support facilitator for this region. You do have to kind of be a little bit careful, right? Because you might stumble on, then how do I know that you did X, Y, and Z if X, Y, and Z are in the same box? You see what I'm saying?
Yes.
Yeah.
Yes. And I get, yes, that, so okay, we're on the right page with that at least. But there is some kind of gray area there of me kind of determining what are the supports a little bit, which that's just conversations with the SSA when we're actually doing the draft.
Yes. Yeah.
But someone else chime in, because I know I have lots more questions on the documentation part, but like I gotta get my thoughts together. I know you guys all have questions.
I'll just add to that a little bit, Jen, because I know we've talked, and I know I talked to Lindsay from Ann Grady about this before. And Lisa and I talked this morning. It really is a judgment call with the teams and the SSAs, how they're kind of structuring that, because it's not like our old format where everything was clearly separated and differentiated and each one was a support. It depends on the person. If we're talking about something like hygiene, maybe it's just a prompt, it would make sense that it be combined, where for someone else, if it's really broken down into individualized steps and looks different on that person's plan, you might want it separated. And so I do think that is really a team discussion. We did have training in February. I'm looking at Anna. We retrained our coordinators on kind of our service and support table expectations, what that should look like. And we talked a lot about the importance of how you guys are implementing that into doc sheets, because I think sometimes they were missing the why and just trying to kind of clump things together to make it easier. So I do think that that will be looking better going forward after that training continues to get rolled out to our SSAs over this next month.
Okay, yeah, we've noticed a little bit recently of asking, we've been having, and the SASs have been great. So like they're doing what we asked, but what's happening to me? They, sorry, they, some SASs are making those very narrative, and that's like not part of actually the support. So we've been asking like taking certain parts out essentially, because then I don't want to choose what I'm putting into my support. So but a lot of more of the information, because the old ISPs were like, okay, help with laundry. I'm just making this up. But then the little note section might say they can put it in the washing machine, they can flip it over, but they might need help with money or something. All that information, I don't know. It's very narrative, and they're getting to be really long boxes that aren't really just supports. Like I'm seeing that as more of the support table, and a lot of the how to support them is already within the ISP. So like we already can look back in certain sections of the ISP saying, okay, when they eat, we might need to like cut their food. That was an example I saw in an ISP that literally said for day program to cut their food 5 times throughout the ISP, but then it was like a very, very long portion of the support thing too. And I was like, well, the ISP already tells us what to do. So let's just kind of make that into more eating, like assistance during lunchtime and eating, instead of exactly, because there was more to it. That's not a very good example. I'm not explaining it well, but so I'm gonna drop that. But I also was wondering, with those kind of supports in there, is there any ones that are like supposed to be in there? I feel like we're getting longer and longer things, and I feel like a lot of the should be, because I know these ISPs were supposed to be kind of making things easier for everybody, of really just supports that person themselves actually need. I feel like we're getting into just checking off boxes of every single support that anybody could ever need is put into those. So we're kind of having to push back a lot of, well, that person doesn't need that, or like every single ISP that we're getting, especially for day program, is we'll help them get them out of a building in an emergency. Of course we will. I don't think we have to document on that every single day that we didn't need to today to help them because there was no fire. We will 100% get people out. But when we've asked back, like, can you please take those out or kind of switch things around, we've been told that no, that has to be in there. So I don't know if there are specific supports that are required for the SSAs to be put in there.
Is that question directed at me, Jennifer?
Whoever wants to answer it.
So, again, I think it kind of goes back to what Erin said earlier, kind of about team process, right? So if Lisa needs assistance getting out of the building because she doesn't ambulate well, and this is how you have to best support Lisa to get out of the building in time of emergency, I could see how that would be important.
Absolutely.
If there's a standard stamped across the board in everybody's plan, help getting out of the building in time of emergency, then I would push back on the team to say, why would that be needed?
Okay. Thank you.
Does that help?
Yep, absolutely.
Okay. Yeah, knowing that, and I'm sorry for interrupting, knowing that providers are responsible for services and supports, risks, and outcomes. So those are the areas, the key areas that providers need to hone in on and make sure they understand what's in those sections, because that is what they are responsible for implementing.
Yes, that makes perfect sense. Thank you.
Yeah.
And I'll just ask one more question, then other people please chime in. So I guess my other question too is it necessary to, like, do we really have to have, so for HPC, this would be a good example. There's things we do with our people all the time. I mean, we could list the ISP and make it 200 pages long. I was going to say 100, but it already is 200 pages long of supports because that people might need. But I know, especially when we got audited last, they had more of like, we're expected, and then for HPC, we're expected to help people brush their teeth and do things that we just, that's our responsibility to help them with. We want to work more on like goals, outcomes, and things that they really want to work towards. So is it really necessary in the support table to have all those things listed out, even if they do need assistance with brushing their teeth? Does that have to be in there, or can we as a team kind of decide like we're going to focus on working on these maybe 10 things really well? We are going to brush their teeth, but we don't need to actually document on 50 supports a day.
Yeah,
because we are helping them do those things.
Agreed. I would ask the team to identify what it is that we feel most important to work on. Yes.
Okay. Thank you, and I'm done.
Yes, thank you. No, I didn't even think of that. I just chimed in to say thank you for that. Thank you. Common sense supports. I love it. Thank you.
I do want to speak to, I know you asked us to ignore your example, Jen, but I do want to speak to it a little bit about the like choking risk or meal prep.
Yeah.
So I kind of just want to address part of it. So there is lots of information in the assessment, lots, really good information. And that assessment information is what is driving the service and supports. But as far as provider expectations, we would not be asking or expecting that the providers implement every single possible scenario that's in that assessment. It is the service plan that dictates what the provider does, which is what Lisa just said. And I did put it in the chat, those 3 areas. So if we're looking at meal preparation and if they're cutting up the food, I'm assuming they have a choking risk. I would be comfortable with it saying something like meal preparation, please reference risk table for the specific protocol, without that being all detailed out again. But I wouldn't be okay with them like referencing back to the assessment, because that's really not the contract or the area that the providers are expected to be responsible for. Even though we provide that to you and it's good information to have and be aware of, it doesn't dictate what the provider is to do. So if we just said meal preparation and there was no detail and there's a choking incident, I do think we would all be liable for not specifying that it needed to be cut up. But if it's referencing back to the risk and the risk table identifies the protocol, I think that would cover it.
Can there, Erin, be a line either that they type into the first box of the support table that says for details on supports, please refer to the ISP? Just so, because with you putting all of those things, Jen is deciphering when she's doing documentation. I'm sure other people here are as well when they're doing compliance is, for us, we don't have a gray area. If something is outlined, that is what we're to do. That's why doctor's orders have to be so specific. Like we can't choose between 4 to 8 hours and those types of things. So if you're putting in there, please refer to risk table, then while maybe your guys are going to say, Jen doesn't have to put in the documentation that says eating, here's the support, please refer to risk table. I mean, she might as well then just be putting cut into bite-sized pieces. So it's not, you know what I'm saying? Like if we just can put a line in there about refer back to the ISP, refer to the risk table, just above the supports in general.
Well, I think if it said cut into bite-sized pieces, that's really not a concern. It seems like Jen's concern is people are writing whole paragraphs of information, and
Right.
It probably in most cases can be consolidated. And I think those are issues we need to address on a case-by-case basis with each SSA.
Okay.
I don't know, Lisa, if you have any more thoughts about that. I mean, I've seen people not address the risks at all in the support table. I've done it where it just says like, hey, behavioral risks, you know, follow the risk table above, because that's part of the actual service plan.
Again, I don't want to sound like a broken record, but if providers are responsible for services and supports, risks and outcomes, you need to be looking at all of those sections to identify the areas that you're responsible, you know, because you're responsible for those 3 areas. So I don't know if a line above saying see risks would help. And I'm not so sure that that could even be put in at this point It might be able to be put in on the Britco side, but I know it couldn't be put in on the Salesforce side. So I don't know how it would even transmit.
Well, and I think if we're not training our staff on the risks that a person has when they are working in someone's home based without it being a support, then that's a agency issue for those individual providers who are not training their employees to accurately keep somebody health and safety. Well, keeping them healthy and safe. Like, I feel like that would fall on us. I wouldn't put that on the county board because you didn't put the risk table in the support table, because I'm not just training staff over the support table. We train staff over the ISP. Who is this person? What do they need? What makes them happy? And what do we need to do to keep them safe? Type of situation.
Yeah,
Lisa, can I just ask Lisa a question? Because I don't know. So I know many of you guys are probably right now for sure are creating your own doc sheets, but I know once we're in Salesforce, the system will print a doc sheet. So Lisa, when it says, you know, there's a risk and who's responsible, and it says Assured Health Services, will that risk line print onto the doc sheet? Because if it does, then I could see that at that point it's duplicated, but without having familiarity with the system right now, it's hard to know.
And unfortunately, I can't answer that question because we're having difficulty, obviously, on our end with the doc sheets and not being able to print. So I'd like to say yes, but I can't like for sure say yes, because we're just having difficulty on our end. I don't know what the answer will be once that gets fixed.
Okay.
But we will be communicating for sure about it, about what it looks like and documentation and how to do it and how to access it. But I just can't answer right now. And I'm sorry for that.
I think the risk table in the Ohio ISP looks different. Well, it does look different than what we had implemented previously in Lucas County. So I'm just interested to know if we can be thinking about it differently, because before it didn't say who was responsible. It just said, here's the risk and what to do. But now it says, hey, here's who's responsible. So if that covers it, you know, I could see that we wouldn't need to be repeating ourselves, and that would make sense to me. Okay.
It makes sense to me too, not
I'll have to find out more.
Yeah, I guess on that, because I'm thinking as somebody putting in documentation, like if somebody, because sometimes we see in the support table just saying like mental health concerns or something. So like technically we're supposed to be documenting that they have mental health concerns and we're aware of it. We know that. I don't really feel like staff should be like, what are we actually documenting? No, they didn't have any today. Yes, they did. Or I actually talked them down. I don't know. So I think a lot of times those things get put into the support table because the information doesn't want to be lost. I get the SSA for sure wants to make sure people know all the risks and all those kind of things. But for me, then I have to document on it. If it's, and you correct me if I'm wrong, if it's in the risks part, I don't have to document on that.
I don't know how you could document on something like that, right, Jennifer? I don't know how you could say, oh, somebody has mental health issue today or not. Like, I don't know how you could document on that. And again, I would encourage, you know, back to the team to say, this isn't clear, back to the SSA, this isn't clear. What do I need to do? That's why everybody on this meeting's input during team process is so important. So when you are requested from the SSA to provide input, it's imperative that they have your information to be able to develop a good plan. And then if you see something that isn't right, to give it back to the SSA for fixing. Yeah. And I know it's a process, right? What I will say is it's a learning curve for everybody across the state of Ohio. And I know it doesn't make it any easier for anybody on this meeting to swallow. I understand that, and I can appreciate that. I really can. Everybody's going through learning curves. County boards in particular, not just Lucas County Board, but county boards across the state, you know, have lost staff, have new staff, training new staff. All of that takes time. However, I can appreciate on the provider's end, I need my information. I need to know what I'm responsible for. It needs to be clear. I can appreciate all of that. if something isn't clear, go back to the SSA, ask more questions, get it clear so that you understand exactly what you're responsible for. And I think to Erin's point earlier, if it is a systemic issue in the county, then certainly there are ways that the department can help with that. And if it's isolated to a handful of newer SSAs, I'm sure Erin is aware of who that may or may not be, and she's working with them. And we can also have Rachel come in for assistance with those specific handful of SSAs also. And we're very willing to do that. And we're very willing to come to the county and sit around the table with the providers and the SSAs. We're willing to do any and all of that to support everybody on this meeting. We don't want anybody to feel like they're getting mixed messages. We don't want anybody to feel like we're keeping information. We want to be as transparent as we possibly can be with everything that we know today at 148. It change at 150, people. But hopefully you understand what I'm saying.
And just to add to it, at the county level, we do have provider support specialists who have been trained, on the OISP, the structure of it, but are available to help support providers if you're struggling with documentation in the meantime before the Salesforce system starts to work and issue that documentation as the new ISPs are being rolled out. To sit down with you and take a look at an ISP and help you make sure that pull out the services and supports that probably should be, in your documentation if you have questions about that. And again, as Lisa said, also, we can talk with the SSA and say, does this meet the intention of the scope of services that the individual's supposed to get, and make sure those are outlined. So we're here to do that. Also, so there was a previous question, and this probably again relates to kind of an individualized situation, but I'll just review it. One of the providers, and it was probably in one of the other meetings, was struggling, said they had some missing or seemed to be some missing or lost trauma information missing from the ISP. They were discussing some alone time or something and found out about some history of trauma. I'm betting to guess that it was probably, an individualized issue. There's nothing in the structure of the OISP, correct, that eliminates notations, the need for notation about trauma if it's relative to supports that somebody, extra supports or risks that somebody needs, correct?
Yeah, I think one of the issues we noticed really early on, and I hope that it's getting better, is that the questions in the assessment are worded in a way that they're read as though it's meant to be asked of the individual directly, and it seems to be present. And so we've had to do a lot of work with the SSAs about, okay, well, if the individual can't express to them what makes the best day great for them or what makes them happy, is the team able to contribute to that? And how are you integrating that information or known information from the past? And I think they got a little caught up with just asking the questions at face value. And because this is the first round, not kind of doing that deeper dive into some of it. So I do know we've kind of done some more training around that and coaching around that. We also have a lot of new staff that may not be aware. And so certainly if you as providers are aware that information has been omitted, that's really important. When you're reviewing the plan, encouraging that to get added back in. Or again, specific concerns we can address, but I certainly don't think it's intentional. I know there is a focus on trauma in this plan, and there are some questions that specifically ask about that. But just overall, that's kind of where I think the issue arose from. Going also from a very much like checkbox kind of plan to a narrative format has been a struggle for a lot of our staff. And I expect as we get through this second round, that more details will be added and expanded upon as they get to know the individuals better in the teams. Lisa, anything you want to add?
Thank you.
I see there's a question in the chat from Andrea about the assessments. Andrea, you want to unmute and ask your question?
Yeah, I guess, and I'm not here to throw anyone under the bus, so I'm sorry. You said assessments, you said they're asking them direct questions. When did this start? I'm only asking that because, and again, I'm not trying to make anyone look bad. I do not know of one person who has been asked any questions or done any assessments from our people who we at least serve 24 hours a day.
So I can tell you what we've trained.
Yeah, no, I totally get it. That's why I wanted to be like,
So,
hold on.
so initially we started the training back in February of last year. We went over the assessment questions, and it has been encouraged to do that through scheduled monitoring and CQR visits, not at the annual meeting, although I am aware that some people are asking the questions or all of the questions, some of the questions at the annual meeting. We don't encourage that. Those meetings are long enough. They're also using the historical documents we have. So they're going off of last year's ISP if they can answer some of the questions that we already knew, because some of it is exactly the same as what we had done before. They're just transferring that information in and then maybe asking a few questions to fill in the gap. And again, there's more we need to kind of still dive into that. I think the assessment is not meant to be asked word for word. So there may be some questions if they don't apply to the person that are getting skipped over.
Rightfully so. So every question's not meant to be asked if it's not applicable to the person.
One thing I appreciate about the new ISPs is the ability to make them so positive about people, like the way the questions are asked. And I know we're doing a lot with the teams and everything of going back and forth of like, hey, can you reword this? Or because if it is taken from different ISPs that were just more of factual, I guess, like I like that these can be narrative in the assessment and really make people look awesome and all the cool things that they can do and be positive about them instead of just facts. So.
Thank you. Thank you. I know that was something that the initial work group was really focused on, was to be able to pull out all the cool things that are happening in people's lives and how we can enhance those. So thank you for sharing that. I've heard feedback from across the state that, team members are learning things that they've never known about somebody and they've worked with them for 20 years. And so it's really cool when you hear those things. I heard it also from a mother. It was very moving when she shared how to date, and it was not in this county, just want to preface, but that she was very touched by the time that the SSA took to learn about her daughter and hadn't felt that had happened prior to the date, and that the questions tapped into her daughter's strengths versus weaknesses. So I appreciate that feedback, Jennifer.
Great, thank you all.
Oh, I was saying,
go ahead.
since no one else is talking, I was gonna say, and Erin, I think your SSAs are doing a really great job at taking all that feedback and everything, because I know we've come back a lot of like, hey, can you reword this, or they don't do this anymore, or can you just kind of say it this way? And they've been doing great. We even had an SSA that was like, I love all these ideas. Like they got really into it. So we appreciate that too.
Yeah.
So it sounds like we complain a lot, but good things are happening also.
Yes, and it is a transition, right? It is a transition. And I know Erin's put in a lot of time and energy with the SSAs and training around the Ohio ISP. And for that, we at the department are very thankful too.
All right. Well, thank you, Erin and Lisa, for all the wealth of information you shared today. If there's